Good day, this is Professor Will, CBMD PhD, and today's Friday, October 8, 2021. It is 1:11 and 48 seconds a.m. Eastern Standard Time. Today's research, weight loss surgeries. So let's hop to it here. Of two common weight loss surgeries, one is safer but less effective. Date October 6, 2021. Source, Michigan Medicine, University of Michigan. When comparing two of the most common weight loss surgeries, a research team found that long-term sleeve gastrectomy is safer than gastric bypass for Medicare patients. 5 years after each procedure, patients who'd undergone a sleeve gastrectomy, which involves removing parts of the stomach, had a lower risk of death and complications than those who had chosen to have their stomachs divided into pouches through a gastric bypass surgery. However, gastric bypass was superior in one way. Sleeve gastrectomy patients were more likely to need follow-up surgery, which could indicate that gastric bypass is more effective long-term, even though it carries more risk. It is really important for patients to understand the risk of significant issues like death complications and hospitalization after these two procedures, because that helps inform the decision about which type of bariatric surgery to choose. You could envision a scenario where a patient is adverse to that risk, and so even a sleeve of gastrectomy doesn't confer as much weight loss. They may want it because it is a safer surgery. On the other hand, if a patient has a lot of comorbidities and a bypass is going to afford a better clinical benefit, maybe that risk is worth it. The short-term studies have shown that sleeve gastrectomy is a safer choice, but this study is one of the largest to analyze the outcomes of the two operations over a longer period of time. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.